Good afternoon. Welcome to day 523 for week 10 at the EMA office, where we bring you the weekly numbers for the COVID, joined with Chairman Mark Kern and Mila Blanford from the Health Department. Mila, you have the numbers this week.
I do, Herb. Thank you. For the time period of August 12th through August the 18th, we have a total of 857 new positive tests out of a total of 7,712 for the reporting week. The age range of those individuals was under 10 into their 80s. The weekly county positivity rate is at 11.1%, with the 7-day rolling average match at 11.1%. The regional positivity rate as of August the 15th was at 10.2%. Unfortunately, we have 8 new deaths to announce today, 7 males ranging in age from 30s to 90s with known and unknown health conditions, and 1 female in her 70s with unknown health conditions. Countywide, we have conducted a total of 416,324 tests, consisting of 35,612 positives and 380,712 negatives. Total number of deaths to date is 501, and our condolences go out to those families. To date, the number of individuals who have completed their 10-day isolation period is at 33,964. Statewide, we've conducted a total of 27,906,468 tests. Total positive of that number is 1,474,285. And that's an increase of 23,191 since last week. Total deaths to date is 23,685, and that's an increase of 134. St. Clair County hospitalization numbers, for total number of COVID-related hospitalized patients in St. Clair County, we're at 77. Regionally, we're at 160. Patients on ventilators in St. Clair County is at 5. Regionally, we're at 17. For congregate care, announcing those in outbreak status, Brea Belleville has 1 new case. Cambridge of O'Fallon has 14 new cases. Caseyville Nursing and Rehab, 7 cases. Cedar Trails of Freeburg, 1 case. Freeburg Care, 5 cases. Four Fountains, 1 case. Grand Manor, 4 cases. St. Paul Home, 2 cases. And Willow Creek Belleville, 1 case. We continue to offer testing Monday, Wednesday, Friday, Saturday at St. Clair Square in Fairview Heights. In addition, Walgreens, CVS, MedExpress, HSHS on Hartman Lane all offer testing, as well as the urgent care on West Main with an appointment. I think most of us have heard that the 3rd dose of vaccine has been approved for individuals who are moderately or severely immunocompromised. We are offering that at our 330 West Main location. You can drive up. That's for individuals who have completed their 2-dose series of either Moderna or Pfizer, and it's been at least 4 weeks after completing that 2nd dose. So again, you can drive up Monday through Saturday. Monday through Friday is 10 to 6, and Saturday is 8 to 4 at our 330 West Main location. There are some criteria that you should meet in order to receive that dose, because it is for those who are either moderately or severely immunocompromised. That information is on our website, and if you drive up, our nurses would be able to help you with that information as well. We talk about testing and the number of tests that we do. We've had some questions about, are we testing sufficiently for our area? IDPH does a regular analysis of the tests that we're conducting for our region, and they are determining that it is sufficient, the amount of testing that we're conducting. Looking at vaccine numbers, we know that we have almost, from the week of 8/10 to 8/17, the number of vaccines that we gave out in the county almost doubled. We also saw for testing from July to August. In July, we had around 20,000 tests complete. And now in August, we're at 16,000 already? So we're seeing an increase in both vaccination as well as in testing for our area. And then I think we have our age breakdown, Randy. Okay. So you can see that we have about 56% of our positive cases right now in St. Clair County are under the age of 40. 24% are under the age of 21. And to the variants that we've had reported to St. Clair County Health Department, now not all cases are typed, but for those that the state does type and give us the variant information, 75% of the Delta variant and about 24% are the Alpha. Chairman Kern?
Great. So, Mila, we're seeing an uptick in people getting vaccinated. So what do you think the reason is? You think people are, they're seeing a lot more people sick, and so they want to get in and make sure they're protected? Do you think it's also maybe school getting started and other employers starting to require vaccines? Are you seeing that?
I think the word is definitely out. We're trying to combat some misinformation that's out there. Again, people are coming back indoors. We know that the incidence of respiratory illness rises in the fall months. Kids are back in school, and people are concerned about having people in close, tight quarters, rightfully so. And I think, again, the word's getting out. We're advertising. There's lots of locations for testing. There's lots of locations for vaccine in our community. And it's good that we are seeing an uptick. And again, as we move closer to the full approval of the vaccine, I think we'll see an increase again in vaccine across our area.
Because only through people getting vaccinated are we going to get through this.
That's correct. It's the best tool we have in our tool belt.
And it's available, it's there, we've all had it, it's proven safe. I mean, hundreds of millions of doses have been given out, and so it's really time for everybody to get vaccinated. So with this, we'll go into the zip code report. Is that right, Herb?
That's correct.
Okay, so we'll head into zip codes. If you notice today, we actually have 3 zip codes that don't have COVID positives. All the rest have significant upward changes. 62201, we're up 11 to 716. 62203's up 12 to 804. 62204 up 13 to 531. 62205 up 14 to 831. 62206 up 41 today to 1,771. 62207 will go up 12 positives today to 812. 62208 up 52 to 2,033. 62220 up 61 to 2,560. 62221 up 67 to 3,375. 62223 up 52 to 2,173. 62225 up 4 to 201. 62226 up 71 to 3,882. 62232 up 24 to 1,051. 62239 up 8 to 578. 62240 up 7 to 206. 62243 up 23 to 873. 62254 up 18 to 906. 62255 up 10 to 106. 62257 up 12 to 402. 62258 up 50 to 1,279. 62260 adds 14 COVID positives to 908. 62264 up 8 to 423. 62269 up 104 to 3,965. And 62285 up 13 to 649. Regional positivity remains the same today at 10.2%, and our 7-day rolling average is down a little bit this week to 11.1%. So we've heard the giant uptick in numbers that have occurred in all of our St. Clair County zip codes. In our local hospitals, that translates to 77 people being in St. Clair County hospitals with COVID-related illness, 5 of whom are on ventilators. And today, to join us is one of our favorite guests on the program. They're all our favorite, but Mike is a bit special to us because he's been here so much. Mike McManus is the president, CEO of Memorial Hospital. Thank you for coming back today. We appreciate you being here. As we said last time, we really didn't expect that that we would be continuing this, but we seem to be in Groundhog Day kind of pattern where this is. We've done this before. We did this a year ago, and here we are seeing this uptick. So, Mike, how are you?
I'm good. I'm tired. Not as tired as some of our nursing staff, but I'm tired. But it's a pleasure to be back again. Didn't think we'd have to do it, but I appreciate everything you're doing at the county, and it's good to be back.
So tell us about the pressures that have really been put on the system. So an already overworked, overwrought base at your hospital now is preparing for this, or has prepared, and is in the middle of this second, or whatever, 10th wave of COVID.
Well, we in the hospital we say we're in our 4th wave, our 4th surge, and And I would also say that, in the last 18 months, have we ever really been out of it? Okay, really what we've been doing is this, haven't we? Okay, and we've really never been out of it. But I would say it's our fourth surge. And it's a little bit nervous seeing what happened in Southwest Missouri and seeing our projections that we're doing within BJC Health System and for the St. Louis region, and seeing what it could be.
So has Southwest Missouri pulled out of it, or are they still?
They're seeing a drop. I please, folks, don't quote me on this, but I was on a call today about 11:30, and I think they're at about 50% of the hospitals there of COVID hospitalizations of what they were at their peak. So they're seeing a drop. What they say is, and with the Delta variant, the curve goes up much steeper, but it also drops off much quicker. Whereas our previous surges, as you know, the curve went up, and then there was kind of a longer run out of that curve.
And why is Delta different in that context?
I don't know. I can just tell you my theory on this because I think it comes back to the type of individual that's being hospitalized, which is trending younger, and. So, a couple of stats for y'all. You mentioned 70-something folks in the hospital in the county. We have 42 COVID patients today. Early June, we had zero. And for 5 days, we had zero. And that was like cause for celebration. I think last time I was on, we were talking about that. There was it was very emotional for the staff. And so the last 5 weeks, if you just look at the last 5 weeks, we've seen a trending up. And we're seeing younger patients of all ages trending up. The 0 to 17 age group, every week, the last 5 weeks, we've seen an increase in the number of 0 to 17 that we see in our ED. Now, we don't take care of pediatric in terms of hospitalizations. We would transfer them to children's, but we're seeing that increase. The one bright spot I can say in this right now is the 75 plus age group is flat or declining over those last 5 weeks. Every other age group is going up, every other one. And that's because that 75 plus group is largely vaccinated. And a lot of, with the skilled nursing facilities and the vaccination requirements there and things like that. So that's good.
So so it brings back, and I know we've said this before, the people who are getting sick in the vast large part, are not vaccinated.
Well, yeah, and so some statistics again, since June when we were at 0, and today we're at 42. And I do want to talk about the future on that, but since June, 91% of the patients that have been admitted to our hospital are unvaccinated for COVID. They've been admitted for COVID are unvaccinated. Our little world in Memorial mirrors what you're seeing nationally in terms of just those statistics and and so they're trending younger, and the COVID hospitalizations are trending younger, and they're largely unvaccinated overwhelmingly. Also, what's interesting, and I think the story that came out with this week, I saw about the percentage breakdowns by zip code in terms of vaccination percentages. I think it's relevant that the first 3 waves or surges that we had are if I remember right, St. Clair County, the African American population of the county is roughly 28-29%. Okay, we were about 50-50 in terms of our COVID patient demographics in terms of white African American. The first 3 waves. This wave, it is 70% African American, 30% white. And if you look at those percentage breakdowns, you'll see that there's lower percentages in some of those, larger African American populated zip codes. And so I think it goes right back to the vaccination percentage, Warren.
So we've got more work to do on vaccinations.
I think we do. I think we do.
You talked about the younger population. So 8% of the COVID positives we know, according to our numbers, are under 10 years old. So you wouldn't see them, they would be transferred to pediatric care?
If they needed to be admitted for hospitalization, they would be transferred to children's, yes.
But there are, under 10, there are kids that have been hospitalized with
yes,
COVID.
I know for a fact that Children's Hospital has children in the hospital that are diagnosed with COVID, yes.
So 17 in the region on ventilators. We didn't see that high number of ventilators for a while.
No.
Is this, has the treatment with Delta virus changed at all? Or,
Of course, since 18 months ago in March of 2020 to now, it has changed quite a bit, and there's been some interesting developments. But we use the remdesivir. We start people on monoclonal antibodies. There's different monoclonal antibodies now that you can start in the hospital. But I do believe with the variant and sort of just the condition of the patients coming in, we were talking about this last night. We are seeing an increase in need of ventilation of these patients. This is a pretty nasty variant, and so if you're unvaccinated, I think I saw last week. I think you had Dr. Schaefer on, if I recall, and he said something. I'm paraphrasing that if you're not vaccinated, I'll likely see you in the ED, and I think he's accurate. I think he's 100% accurate.
and so some people say, well, I had COVID, and I've got these antibodies in my system, which is just as good as getting vaccinated. How do you respond to that?
Again, I'm not a infectious disease physician, but it's good, okay, but it's still not as good as getting vaccinated, okay? There's still plenty of literature and evidence that's not misinformation, and I have to say there's a lot of misinformation out there, and for the life of me, I can't understand why people are spreading misinformation, but they are. And there's a lot of legitimate information out there that says even if you had COVID, vaccination is a benefit to you. And so we can provide that to anybody that wants to know it. I do want to talk about the projections, okay? And we could reach or exceed the highest we ever been by the second week of September. We were in the mid-20s last week. We're in the low 40s this week in terms of COVID hospitalizations. And the St. Louis Pandemic Task Force does these projections out there. And they show by like the week after Labor Day, the curve is going up pretty high, and we could be at our all-time highs again by the second week of September. And again, 91% of those likely will be unvaccinated.
And Mike, the way we slowed it before was we washed our hands, we watched our social distance, and we wore our masks.
Yep.
That's still a way to maybe break this trend.
Yeah, and I think that's an interesting point because I'd like to maybe talk a little bit about and I don't want this perceived as we're throwing in a towel, but I think we have to talk about what the future will look like, and if this is the way it is. Now I'm hoping FDA approval would increase vaccination percentages, like Mila said, but we're in low 40% in this county. And if we've plateaued, okay, which I hope not, but if we have, because I don't think there's much appetite out there to really take on this issue more, which is disappointing. I think you've been a strong advocate, and other people have, but it seems to be sort of could be plateauing, and all over the place here. But more and more employers are mandating vaccine, which will encourage the percentages, I think, along with the FDA approval. And so those things will help. But how much further will it go from the low 40s? I don't know. The other interesting thing is I think it's becoming less controversial. It used to be when you saw someone a month or two ago even came out and said, whether it's whatever big business, said mandate a vaccine, it was a news story. It's becoming less of a news story now. It's becoming commonplace. But in talking about where the future is going to be, I think we're all going to meet COVID at some point, okay, whether you're vaccinated or unvaccinated. And because this variant is just kind of pretty contagious. And so if you're vaccinated, you stand a much better chance when you meet it than if you're unvaccinated. The symptoms are less. It's more like it could be more like a cold, things like that. I think the 91% just bears that out, quite honestly. So we're all going to meet it. And depending on your vax or unvaxxed, your reaction is going to be different, and your outcome will vary. So I guess what I'd say is, the Delta variant's made it more challenging. we like to talk about breakthrough cases, and you hear about, and I'm getting your question about social distancing and masking and vaccine, but we like to talk about breakthrough cases, and I think people like to say, see, why bother? Why bother getting vaccinated? Look at that, someone got COVID even though they were vaccinated. Well, your outcome is going to be vastly different if you're vaccinated or unvaccinated if you get COVID. And by the way, breakthrough cases are still relatively rare in the grand scheme of things. So I think here's the issue. The more unvaccinated people we have, at least from my perspective, the more hospitals will be overwhelmed, okay? The more schools, in my opinion, will likely be shut down because there's going to be an outbreak somewhere, because under 12, you don't get vaccinated, right? Travel, I think, will be impacted, all those things. And not to mention, creating an environment for new variants among unvaccinated. I think that's just epidemiology. So your point is, why mask, why vax, why social distance? You will be impacted less, you as an individual, okay? It'll lessen the chance of a personal bad outcome. I'm making a personal plea here. It buys time for healthcare, quite honestly, between surges. And for healthcare workers to get a break, maybe. Might lessen surges, okay? Are we going to have this big wave that we're talking about and be done, okay, with this going on? Maybe, but I doubt it. I don't think so. I think we have to start talking about what this is going to be and how this pandemic will run its course, okay? And I think we're going to have a series of surges because of the low percentage of vaccination. They might be smaller and smaller, but I think we're going to have a series of surges, so it kind of peters out, and we get to a point of enough vaccination and enough people that have had COVID and this and that and experienced the bad outcomes potentially that they're going to be at risk for, to the point where the virus has no place to create disease. The virus is one thing, the disease is the COVID. The virus has no place to create disease, and I think that's kind of where we're going to be.
Unless a variant is created that is far more deadly and does
well,
a lot more.
I said, again, I'm no epidemiologist, but the unvaccinated population creates the petri dish for that to occur potentially. It really does. That's just my opinion. I think we're going to be in this. I think we're going to see a pandemic that's going to keep going, just because this is where I think we have to talk about the future like that, which is really kind of sobering.
And so, misinformation that's out there,
Yeah.
Where would you recommend? So, I mean, you're the president of Memorial Hospital. There's no one that has higher integrity, and certainly somebody that only trusts the best of information. If you can tell people, because there's a lot of people that are out there that run into somebody that, I was with somebody today, they were citing a doctor from Florida who's just way out there and is wrong on all of this, but he's a doctor, and so he says, this is the way I feel, and he thinks you can cure COVID with some vitamin D or something. Where can people say to a person that is citing that as fact, where can we tell them, okay, you don't need to listen to me, but here's a site to go to? Is it CDC?
Yeah. Well, yeah, and I get as frustrated with the CDC as anybody else. I honestly, because it feels like they're flip-flopping, going all over the place. But I think they're chasing a moving target, truthfully. Yes, the CDC, and I think that's a definitive voice. But I can understand sometimes how people can feel frustrated by the CDC. I get it, because I get frustrated by the CDC sometimes. It's overly simplistic, but I would say it's the same place where you go for all your other medical information. Go to people you trust. Washington University, BJC Health System, Mayo Clinic. They got ample resources out there. If Memorial, we have plenty of resources. We can provide those things to you. When people say, "Well, I want to do my own research," I I don't do my own research, I'll be honest with you about this, because you know, I'm not an epidemiologist and I don't have years of public health training and expertise in this. I have, you know, I do a little bit, but I have to rely on Dr. Hillary Babcock, who's the infectious disease expert at Washington University, and I talk to her and things like that. So, you know, do what you always do, is rely on the people that you go to for your health care. I do want to, if I can, I do want to talk about, it's interesting, you know, this has become a battleground about choice too, right? Okay, I hear a lot about choice, and you know, it's my choice to be vaccinated versus mandated, or it's my choice to wear a mask and things like that. I firmly believe that. You know, now we as BJC Health System, we have a mandate for all our staff to get vaccinated. I'm 100% supportive of that, because it's clearly the best thing for our patients, employees, and visitors. But you know, folks do have a choice. They do have a choice to get vaccinated or not. I just ask them to think about the implications of that choice. I think if they choose not to be vaccinated, they have to assume that they will get COVID. I think that with this variant, I think that's a foregone conclusion, just like Jeff Schaefer said. And you may get pretty sick. You may get pretty sick. And I think that choice also impacts people. It impacts our healthcare workers who are burning out, and other people like immunocompromised folks who, for the last 18 months, how vigilant have they had to be? So choices do have implications. And you know, I just want to reinforce that.
And they don't just affect yourself.
Correct.
It is your choice,
Correct.
but you also can give this to someone else. If you're not vaccinated, you become a vessel. for
And look,
COVID.
I'm vaccinated. I could give COVID to somebody else, because the literature is showing now that vaccinated or unvaccinated with this Delta variant, you could be carrying it, okay? I may have had it and I don't even know, quite honestly.
This is a terrible virus that we've been dealing with and we'll continue to learn about, but hopefully we can eradicate. And that's what really vaccination is all about, is the eradication of this virus.
Yep, and we cannot, that's our best tool, as Mila said, and I agree with you 100%. Vaccination is our best tool. And we have to just keep spreading that message. But, and I'm not trying to be pessimistic, but we also have to realize that this pandemic will run its course, because we probably will not get to the numbers that we need to get to with vaccination, because I've seen studies that you get to 90% plus. What's the likelihood of that? And so that's where you get to the masking, the social distancing, the other things that help buy time and help protect vulnerable populations or your healthcare system from being overwhelmed as this thing runs its course.
Thank you, Mike. Herb?
Couple of questions, Mike. I'm glad that you are able to maintain your composure from some of those late night calls that we have when your frustration really comes out, and I really appreciate the professionalism. But what is the visitor policy right now at the hospital?
It's unchanged. We are reviewing it, but one visitor right now for a day. Can't change it for the day, and then 2 in OB. And we're looking at changing it. I know St. Elizabeth's has changed their visitor policy recently, or maybe today, if I remember. But no, ours is unchanged.
Okay. And I want to talk just a minute. You briefly touched on the staffing, and I know quite a few people that are on that front line in the ED or on the floors at the hospital. How is the staff holding up? I know you get reports from your charge nurses and stuff. How are they holding up?
It's tough. It's tough. They're burned out. They're tired. They're quite honestly, they're a little bit resentful that we're in this situation again, when potentially it could have been prevented to this magnitude, and so it's tough.
You know, and we talked a little bit before we went on the air today about the deaths. When you have the limited visitors to see their loved ones in the hospital, that nurse, that tech becomes that extended family of that patient. So, and there's all the horror stories out there about how, you know, people don't get to see their loved ones in the hospital like they normally would.
Yeah.
You know, whether you're in there for a heart condition or whatever it may be, all the patients, you're trying to take care of them equally, but that's got to be tough for the staff.
Yes, very emotional, very emotionally draining, and we've had recently some, because we are seeing younger folks in our hospital, and we're very sick. We're seeing some, tragic situations that are tragic for the family, and tragic and emotionally devastating for the staff, because you are sitting there with an iPad. And because of the visitor policy and the precautions and talking to people and the nurses holding that iPad as that person who's on a ventilator is just trying to communicate, and it's devastating.
Well, I think that pretty well sums it up. For the last 2 weeks, we've had the experts on. Last week we had Dr. Schaefer, who was very blunt at the end, saying that for those of you who for whatever reason, whether could be your religious beliefs, your political beliefs, whatever it may be, if you choose not to get vaccinated, that is your choice. You just heard Mr. McManus say that, Chairman has said that, I've said that, we've all said that. But as Dr. Schaefer said, that for those of you who are just being stubborn about it, I hope the time doesn't come when you're looking there or talking to a nurse at the hospital because you can't see your mother or your grandparents or one of your children because you have refused to get vaccinated. There's no reason out there why that I can think of that you would want to be a part of this solution. When you hear these numbers, when you hear in our county alone today 501 people have lost their lives to this, and I don't want to hear about those are false numbers. These are numbers that are compiled. These are confirmed numbers. 501 of our county residents in the state of Illinois, 23,685 people have lost their lives, and there's no telling how many more that's going to be. I can tell you one thing I do know for sure, it's going to increase if you don't become part of the solution. And you can do that. And Team St. Clair members, those of you who follow us, there's some questions on here today. We'll try to answer them later on this evening. But we appreciate what you do, trying to continue to spread the word, because we're going to continue to do that. We have been for 523 days, and we thought we would be over this, but Mike, we're still here.
Just to comment on that, when you talk about the 501 deaths and things like that, oftentimes I hear the immediate response is, well, did that person have underlying conditions? Almost as if that rationalizes the situation, which, does it really make a difference? I mean, I don't think that really makes a difference here. Perhaps they have underlying medical conditions, but that person may have been around for a number of years.
Right. Well, and I think you said it right. Do your research. Call your family physician and ask them, and they're going to tell you if you are a candidate for the vaccine. I don't know any physician that's not going to tell you his honest medical opinion. So you have all the resources, as Mr. McManus has said. You heard Milo say it. We've said it. It's the best tool we have in our toolbox. So please use that tool. We'll be back next Wednesday unless something changes for week 11 of our daily update. Everybody have a good evening.